we move on. As we first told you on CBS3 at 4 yesterday, hospitals in Delaware are running out of space due to a surge in COVID-19 patients. Christiana Hospital in Newark, the state's largest, does not have enough beds to treat patients. It is running at least 15% over capacity, and the hospital says it's treating patients in hallways, calling the situation dire. All elective surgeries have been postponed to free up staff and resources. Among those with COVID-19 at the hospital, many are unvaccinated. Joining us right now to talk about the COVID-19 situation in Delaware is the state's governor, John Carney, joining us from Wilmington tonight. Thank you, Governor, for joining us.
Good to be with you, Siafa. Thanks for having us on.
So first and foremost, what is the state government doing to help the hospitals that are struggling right now?
So we spoke with the hospitals. I speak to them almost on a weekly basis. We had them on the call this morning, offering our assistance. One of the challenges that they have with their hospitals being full, their emergency rooms being full, not enough rooms to treat their patients, is they're having a difficulty releasing some of those patients that don't need hospital care to alternative care facilities. And so we're pursuing various options to help them out there. The other thing is just to get the message out that these are preventable conditions with COVID-19. Get vaccinated. If you're not vaccinated, get vaccinated. If you don't have 2 doses, get your second dose, get your booster dose. Make sure the younger children that are now eligible are getting vaccinated as well. Wear a mask when you're in public, and be careful with your holiday celebrations. And so think about people that need to get treated in the hospital in that capacity. That's precious to all of us.
Are you at a place where you have asked or feel like you need to ask the federal government for help?
Well, the President of the United States was on the news yesterday. We had our White House call yesterday as well. They're providing some resources in terms of testing resources that states need to get those rapid tests so that they can make sure they identify people that are positive, COVID positive, so that they can quarantine and protect others around them. So help is on the way from the federal government. I mentioned the alternative care facilities that we're focusing on. That would be with National Guard resources and a quick training program to get them up to speed so that they can help our hospitals.
And Governor, what would you say to convince people in your state who are not vaccinated to get vaccinated, if anything, you think?
Yeah, that's the most important thing right now. We have pretty good vaccination numbers. Our most vulnerable populations, those over 65, over almost 100% with at least 1 dose, and 92 or 3% fully vaccinated with the boosters in the 60% range. Our young adults, not so much, about 60%. That means 40% of those young adults are not vaccinated. They don't feel much at risk, but they are become someone that's vulnerable to getting the virus and then passing it on to someone else and creating that spread that's causing the problem in our hospital and the overpopulation there.
All right, Governor Carney, thank you so much for joining us this afternoon. We wish you and your family a very happy holiday.
Happy holidays to you, Siafa. Thanks for having us on. Everybody out there, get vaccinated and wear your mask.
Thank you, Governor.